Good morning, ladies and gentlemen. I'm Philip Hunt, and it's my great pleasure to chair this morning's session and to make a few introductory remarks. What I want to just explain to you is how we believe passionately that the widespread use of GS1 standards can help the National Health Service in our country be more efficient, but also help clinicians be more effective in the way they treat patients. Our NHS is nearly 70 years old. This is a hospital 2 miles away, University College London Hospital. It's one of 100 new hospitals that have been built in the last 20 years as we endeavour to make ourselves fit for the 21st century. And every hospital, every health clinic face considerable pressures at the moment, just like many other healthcare systems throughout the world. We think that GS1, through the adoption of our standards, can help the NHS actually meet some of those challenges. Just a little bit about the National Health Service. This is the NHS in England. There are separate NHS services in Scotland, Wales, and Northern Ireland, but take the biggest, England. It's a big undertaking, and it's unique in the sense that as patients we do not pay for virtually any of our treatment. It's actually paid for out of general taxation voted by Parliament. And although it's run locally by local boards, one of the key points I'd make is that ultimately its leadership and direction is in the hands of ministers answerable to Parliament. And that is highly significant when it comes to the adoption of our standards. I talked about the pressures that healthcare systems face. Our National Health Service is no different. In the last 10 years, our population has grown by 7%. The number of people with long-term conditions like dementia has grown by 1 million. And you'll see from the slide that as the increase in number of patients that come through our doors has gone up pretty dramatically, the amount of money available has been less. And so it's been imperative on our National Health Service to improve its efficiency. And this, of course, is where GS1 comes in so well. Those of us in the industry will think it's a no-brainer. The evidence is out there, both in the UK and elsewhere, that the adoption of our standards can make a huge difference. And as you've already heard from our Chief Executive, the dramatic breakthrough in the UK occurred 2 years ago, or 3 years ago, when the government mandated the use of our standards. And you will see that it started because they thought that it would help improve the efficiency of the supply chain. And of course, it does. But for me, what is even more significant is that the early evidence shows that we can also improve clinical standards. So alongside the mandation of our standards throughout the NHS, the Department of Health also put £12 million into establishing early adopters in the use of our standards. And in a moment, you're going to hear from one of them, from Derby. And what's happened so far in the very few months that it's been in full operation is that not only have considerable monetary savings been made because of improvements to the supply chain, what you'll hear from our colleagues in Derby is just how it's also had a really positive impact on clinical outcomes and understanding. I also want to just show you another trust. It's not an early adopter, it's in the north of London, but this is a trust that ran into major problems with its medical records. And as you'll see, about 10% of consultations between doctors and patients were taking place without the patient's medical records being available. And understandably, this was of great concern both to the trust and to the quality regulator. And it's been turned around by the use of GS1 standards. You'll see a dramatic reduction in the number of consultations taking place without medical records. There was a 12% increase in the number of patients being able to be treated at no extra cost. There were less clinical cancellations, higher satisfaction amongst patients and doctors, and 19 less staff were employed within medical records. Now just think what could happen if we can translate that experience both through the NHS and also globally. And here I just want to say that what is happening in the UK is running in parallel to the Project Imagine project, which GS1 Global is leading. And I want to pay tribute to Ulrike Kreiser, who is leading this effort internationally. And a paper that she oversaw in terms of executive leaders' perception of what we can do in healthcare is absolutely fascinating, looking at different healthcare systems, looking at how the adoption of our standards can enhance both clinical outcomes and efficiency. So, ladies and gentlemen, what we're seeking to do this morning is to demonstrate to you some of the outputs that we have seen from the use of our standards, and I'm sure at the end of it you will think that this is something that is well worth developing on a global level. Healthcare systems the world over face enormous pressures. We know that. The adoption of GS1 standards is not going to solve all those problems, but my goodness me, it can certainly make a contribution. So welcome to our conference. I'm sure you're going to enjoy it, and thank you for your attention.